In order for me to bend my knee, what happens is the muscles behind the upper thigh, these are the hamstring muscles. They have two attachments that come down. They attach down below the knee. They grab this lower leg and they pull it back. That's just plain language, the easiest way to explain it. The hamstring is actually 3 muscle bellies, but let's just say it grabs the lower leg bone and it pulls it back. That's what makes my knee flex. If you think of the anatomy, we've got the femur, which is the thigh bone. We've got the tibia, which is the shin bone. The tibia actually moves around the femur. The femur tends to stay in one place. So what we want to understand is, in order for me to get knee flexion, I need this bone to be able to move inferior and posterior relative to the bone above it. A lot of times what we try to do in therapy is we try to push the lower leg bone back and behind the upper leg bone. But as soon as I start to push, that's a very threatening activity. And so my muscles, my nervous system, everything wants to resist that, especially if there's pain. Now, this is an important distinction between somebody who doesn't have full knee flexion because of connective tissue tightness and people who don't have full knee flexion because of pain. If you're trying to fight pain, fighting pain with brute force is almost never a recipe for success. So what I want to do, what I want to recommend is, rather than thinking about pushing the knee into flexion, think about pulling the knee into flexion. And pulling is using the hamstring muscles. So any exercises or activities that you can generate force through the hamstring. Now I'm sitting on a high table, but what I would do is, if this was my couch at home or the side of my bed, if this was the leg that I was trying to improve knee flexion on, I would get into a position very similar to a heel slide. You guys remember the heel slide. I would get to the position where my knee is about as far as it's gonna go. It doesn't wanna bend any further. And then from here, I'm going to engage the hamstring. I'm using my muscles to try and pull it back just a little bit more. So once I get to this end range of motion for whatever's available, my hamstring fires, I pull. I should see either a little bit of motion on the surface that I'm sitting on, or there should be some sort of movement going on. I'll repeat this 10 or 15 times, just activating that hamstring, relaxing, activating, relaxing. It's easier if you recline. So if I'm laying back, maybe I have a pillow behind me, I get that knee bent. It doesn't matter what the actual range of motion is. I just want to bend it as far as it'll let me. And then from that point, I'm going to pull with my hamstring and relax. Pull with my hamstring and relax. Once I've done that 10 to 15 times, now what I've done is I've started to condition the nervous system. I've started to condition my body so that it understands we want to pull this into flexion. Now what I can do is I can slide just a little bit and then lift and come back out. I slide, lift, and come back out. So the first series is an isometric movement. I'm pulling, there's really nothing happening in regards to movement. Then I go from isometric to concentric. So I open the joint and then I slide the foot in as my hamstring is doing the work. Now, what I want to do is I want to go to a gravity-assisted position. So either I'm going to lay back, I'm going to have the foot in the air, maybe I can support the upper thigh, and I'm going to pull and extend, pull and extend. And again, I'm using my hamstring muscle to pull, but gravity is helping me pull it down. Or if you're not comfortable laying on your back, I can sit at the edge of an elevated surface, something that doesn't let my foot touch the ground. And I do the same thing. I allow gravity to pull down. I use my hamstring to give it overpressure, and then I kick it into extension so that I have room to allow the foot to drop down into flexion again. So I would repeat this 10 to 15 times. I would repeat this multiple times a day, usually about 3 times a day, morning, afternoon, evening, but you can break it up however you want. And the idea is, what I'm trying to do is condition my nervous system, my central nervous system, to re-engage the hamstring muscle to try and use my own body system to pull that knee into flexion. Now, if you've been struggling to get knee flexion and if you had 1 or 2, or some patients have even had 3 manipulations under anesthesia. I don't want you to think that this is a secret recipe or that this is some magic trick that's going to work for you. It's just going to prepare your body to put you in the best possible position to make steady improvement. Steady improvement could take months, it could take years, it could never happen. But this is really the way the knee is supposed to function, and this is putting you in the best position possible to make that full knee flexion 90, 120 degrees possible.